Good afternoon, guys. This is Dr. Bhupesh from Dr. BKM Institutes. Please subscribe our channel if you have not for the best OET sample videos. Our job is to tell you how to do OET questions. We don't create question papers. We discuss various kind of sample papers, various kind of listenings. As today we are going to discuss the listening. So I'm just going to play this listening for you to make sure that you all understand and you can understand how to do reading part A, B, and C. But before I do that, I really wanted to discuss this special thing for you, that how the scoring goes in listening, how many marks are required to pass your listening. So this is like an important question to understand because till the time you do not realize that how to work upon. So OET listening, if I tell you in simple words, I will switch on my video for you. Yeah, OET listening, if I tell you in simple words, see, this is OET listening. It has got total of 42 questions. So you need to understand this simple thing, 42 questions. And normally I would say even if somebody scores 30 to 32, that person passes. So 32 is surely the marks that will help you to pass. Now, please understand, part A, if out of 24, at least you can secure 20. I'm saying 20 less, you should secure more. Rather, I would say 21. Part B, there are 6 questions if you can secure around 4 questions. Part C, first extract if you can secure 4 questions out of 6. Part C, extract 2, again 4 questions. So the basic fundamental for us is 20 plus 4 plus 4 plus 4 is equal to 32. That means to pass OET listening, we need A part to be strong. And please understand, it is difficult, it is different, sorry, it is difficult is nothing in OET. This is the wrong word. This is the worst word I can use for OET because OET is very simple. Now coming back to basics. So in OET reading, you will get 20 questions in the reading part A. In the part C, you have got 8 plus 8, 16 questions. Whereas in this part C of listening, you have got 12 questions rather than 16. 6 plus 6. So you need to understand two questions would be such which would be very difficult. Two questions in this would be very difficult. Two questions in this would be very difficult. And four questions in this would be very difficult. So you can well understand margin is 24, 4, 4. We can pass 32 easily. Suppose two questions we do wrong out of these easy questions. Then out of this 4 plus 2 plus 2 plus 2, that means total of 10 questions. You might do right as well, A, B, C, D. You never know. Even the difficult questions can be right. So please understand in OET listening, there are high chances to pass if you do not panic, first thing. Second, if your writing is neat and clean, this is also important because sometimes people do not pay attention to this thing. If your writing is neat and clean in the listening part A, it can make a huge difference. And if you get 20 marks in the part A, that means there are higher margins that you can pass. But still, I understand your anxiety when it comes to listening part C, that we panic because the time is very less. You have to choose from the multiple choice questions. So what you can understand from this simple thing, you target only 4 questions and 2 questions would be difficult. Always keep that thing in the mind, then you will feel at ease. Now I would tell you how to do the listening. So this is the listening that you have told me to do today. I have not done this listening. I don't have any idea about this listening. So I'm going to play part C. In the part C, you will get 90 seconds in the start in each extract. Extract 1 separately, extract 2 separately. Extract 1, you will have 90 seconds, 1 minute and 30 seconds. Lot of time. What to do in this 20 in 90 seconds? You will have this question paper. You try to understand the topic. So I will try to understand the topic. You hear an interview with the sports injury specialist Toby Walsh on the subject of hamstring injuries. So the topic is hamstring injuries. Toby explained that sports people fear getting hamstring injuries because first question is why. So always try to relate to the topic why hamstring injury is important for sports people. Otherwise, we can understand hamstring injury is important because they will not be able to play. They will bear the financial losses. They will not be able to play for their country. That is why they fear hamstring injuries. Normally, second question, Toby explains that hamstring injuries are common in sports which? In which kind of sports? In which kind of sports? Third, in terms of preventing, now sports person is scared. First question, in which sports? Second question. Third, in terms of preventing hamstring injuries, Toby mentioned that sports people need to, means that how to prevent it. When sports people are scared, they want to know how to prevent it. Third question. Fourth, Toby suggests that during the intensive training programs, what is Toby's first concern when treating? So the topic started from the problem, topic started from sports, topic started from prevention, reached to prevention, then went to intensive training units. Now it is going to treatment. What does Toby say about recovering? So now you can understand the whole topic. This is what you should do in the first 40 seconds out of the 90 seconds to understand the topic, hamstring, why sports people are scared. Then you go to the next question, that common in which sports. Third, prevention. Fourth, intensive training. Fifth, treatment. And sixth, recovering. Now you know about the topic and you will have fair idea, because hamstring injuries are common sports, like people who would play cricket. In cricket we have seen lot of hamstring injuries, football, soccer, you have hamstring injuries to sports people anyhow. Now we understand the topic, and by the time your 40 or 50 seconds would be gone, now you should focus on the first question. Toby explained that sports people fear getting hamstring injuries because it takes a long time to recover. Yes, maybe. There is a high risk of reoccurrence. Yes, maybe. The therapy can be very painful. This I do not think therapy can be painful. In today's time, no therapy is painful. Most of the therapies are not painful. C, anyhow, I do not think as an answer. But A and B has high chances because recovery might take time, or maybe there is a high chance of reoccurrence. That is how, even before he will start to speak, I would be ready with my first question. Second, Toby explained common in sports which tend to involve players in the long matches, popular with the players of different ages, require players to move in certain ways. C and A has more chances. Are popular with player of different ages? Mm, doesn't seem like an answer, because hamstring injuries can happen to anyone. In cricket, most of the time people are young, so hamstring injuries are still common. But these two involve people long matches or require people to move in certain ways. By the time it will start playing, let's say 90 seconds are over. Let's see. So by the time you should have at least 2 questions in your mind if you want to prepare good for it. And again, focus on 4 questions. 2 questions would definitely be difficult. Don't worry about all the questions, because this is, I am not saying that you should not do 6 questions right. I am saying just feel secure if you find 4 easy questions. So prepare your mind for 4 questions.
Hamstring injuries.
Work hard in reading part A to secure your 20 marks at least. If you can score 22, then in the part C, even you do 3 questions right out of 6, still will be manageable. So make your A part strong. And now we will play this listening. Let's see how it goes. So now it's all about focus. I understand the topic. First question would be hamstring injuries. Sports.
Today is a sports injury specialist called Toby Walsh. We're going to be talking about hamstring injuries. Toby, hamstring injuries are something sports people at all levels of ability fear getting. Why is this?
Well, you're right.
So my question was why? Why is this? Now he will let. So wherever the word because or as comes, that is my answer. Because or as.
Are the most significant injury in a number of team sports, including football and rugby, but any sports person could be affected. I think, looking at the statistics, hamstring injuries account for the largest number of lost playing hours amongst professional footballers, even though the average injury only takes about 3 weeks to heal. More worrying for the individual is that once they've had such an injury, the chance of sustaining another one in the same season is as high as 20%. So it can become the thorn in the player's side.
So it can become the thorn in the player. Thorn means like every rose has a thorn. Thorn means kanta. Every rose has a thorn. So it can become thorn. That is what is the fear of people, that it can happen again. 20% of the people face again. And they were saying it is the largest injury. So A can be the answer and B can be the answer. This question is confusing. I cannot do it with complete surety because even A was spoken that it takes long time to recover. Second thing he said that there is a high chance of reoccurrence because it can reoccur again. So I have to listen to it again. Obviously in the paper I will get one chance. This question is difficult for me. Either I will do A or B. More chances of B because thorn word was spoken in the end. So, but still, I would like to listen to it again to tell you in a better.
Most significant injury in a number of team sports, including football and rugby, but any sports person could be affected. I think looking at the statistics, hamstring injuries account for the largest number of lost playing hours amongst professional football.
So largest number of playing, but now largest number of lost hours means people are unable to play. But it is not saying that individual player recovers longer time. They are just talking in general that hamstring injuries are the most common injuries which are responsible or which are kind of which is the reason of player not playing for a long time. So overall they are talking about, they are not talking about an individual player, or they are not talking about the recovery time. This is the line that you should understand. I will play it again. Let's see.
Most significant injury in a number of team sports, including football and rugby, but any sports person could be affected. I think looking at the statistics, hamstring injuries account for the largest number of lost playing hours amongst professional footballers, even though the.
So it is talking about footballers, and it is talking about that overall footballers lose the maximum hours because of this thing. But it is not saying that it actually leads to a longer. So this is the difference. So less chances of A answer. It can be the answer. I'm not saying I'm 100% sure. But what I can understand, it is talking about overall players. When you add on to those players, then this sport is responsible for the largest number of hours lost. But it is not saying that, it is taking time to recover. What I mean by this statement, suppose if one person is losing 2 days or 5 days because of this, and if 100 players are complaining of hamstring, so total overall days lost are 500 days. So what I mean, he is talking about overall footballers, but he did not talk about recovery time. But anyhow, indirectly it can be answer A, can't be. Let's see whether B is the answer or not. Now he will talk about the B option.
Average injury only takes about 3 weeks to heal. More worrying for the. I think looking at the statistics, hamstring injuries account for the largest number of lost playing hours amongst professional footballers, even though the average injury only takes about 3 weeks to.
Oh, thank God. I did not listen to it for the first time. A is completely ruled out. Ruled out means eliminated. A is not my answer because he's saying it takes only 3 weeks to recover. So elimination method, A is out. That is why I say OET reading and listening part B and C, elimination method will work the best. Rule out the A option. 100% answer is B now because it is saying it takes only 3 weeks to recover. Now I'm 100% sure my answer is B.
More worrying for the individual is that once they've had such an injury.
More worrying, that means fear factor. More worrying is
Chance of sustaining another one in the same season is as high as 20%. So it can become the thorn in the player's side. That, I think, accounts for the reputation the injury has.
So
the main reason becomes B. Now this question, which when I listened to it for the first time, was appearing difficult. That is why I am telling you again and again. I know in the final exam you will get only one chance, but it is about training your subconscious mind. Please do one listening 3 times. Don't do 3 listenings one time. Do one listening 3 times. That is the biggest mantra of passing, because you will understand the elimination method, how to apply it. Once your mind knows it, then it would be able to apply. Like in this case, it takes only 3 weeks. And then he said more worrying. So now my answer, which was 60% B, is 100% B. That is how you do listening. Please understand. I will try to record another question for you.
is this an injury that can affect any of us at any time?
Well,
Now my question is common in which? By the time I will keep on reading the options, that long matches, different ages, or certain ways.
hamstrings are a group of muscles in the thigh that allow us to bend our legs and knees effectively. Now, some ethnic groups are more predisposed to these injuries than others, and everyone's chance of
Predisposed means, one day we were discussing reading, you guys were asking me, sir, please tell us the meaning of vulnerable. Vulnerable means people are prone to injuries, and predisposed also means the same thing, that some ethnic groups are predisposed means are more vulnerable to injuries, are more prone to PRONE, are more prone to vulnerable VULNERAB. Vulnerable means they are more prone to injuries. So predisposed is also the same word, that there are high chances of injuries in these people. So I will make you listen to this line again.
the injury has.
So is this an injury that can affect any of us at any time?
Well, the hamstrings are a group of muscles in the thigh that allow us to bend our legs and knees effectively. Now, some ethnic groups are more predisposed to these injuries than others, and everyone's chance of tearing the muscle increases with age. But apart from that, they're generally the result of
Tends to go with the age, but it is not saying it is popular with players of different ages. He's saying the more age will increase, the more chances of injury. So B, he has not talked about. Age is the only word he has spoken, but he has not talked about popular with different ages. He has not talked about it until now.
bursts of movements like sprinting or suddenly changing
Sorry.
to these injuries than others, and everyone's chance of tearing the muscle increases with age. But apart from that, they're generally the result of short bursts of movement, like sprinting or suddenly changing direction.
Short burst, BURST, short burst of movements like standing, sprinting. Sprinting means running very fast. So when people are moving in certain ways like sprinting, bending, sitting, sudden short burst means in the fast way. If you are moving, then it can lead to injury. As per me, let's listen to it again.
Legs and knees effectively. Now, some ethnic groups are more predisposed to these injuries than others, and everyone's chance of tearing the muscle increases with age. But apart from that, they're generally the result of short bursts of movement, like sprinting or suddenly changing direction. And they happen more in certain sports because these are just the sort of movements that players are making. They happen most often at the end.
So these happen in sports in which people, because in some sports people are making fast movements, certain movements means specific movements like sprinting, changing directions, and all that things.
What we call the swing phase of running, just before the outstretched leg hits the ground and the muscles contract to bend the knee.
But I'm sure there are ways to.
So it did not talk about long matches. No way, my answer. Again, he will always confuse you only about the two options. Like in the first question, even before reading it, we knew that C is not the answer. Even in this question, popular with different ages, hamstring injuries, we know has happened to even Virat Kohli now, has happened to all the youngsters even. So it can happen at any age, and it increases with age, obviously. But it is not saying popular with players of different ages. So popular word was not there. Long matches word was not there. So the only answer I can do is C. Easy question as compared to A. But A was also easy because it was my warm up. It was my first question. That is why it took time. So please, the most important instruction again. That is why I always say, please subscribe our channel. At the same time, please listen to my videos till the end. Always. Because there are certain points I talk about. Like in this case, you need to understand that two options would be the main problem. If you can eliminate is the word, because popular word was not spoken, long matches word was not spoken. And again, warm up, the most important instruction which I wanted to give, please understand this instruction. Warm up is very important before you go for your OET exam. Like in the morning you would be in complete rush, but please listen to something, whether it is an English song, whether it is one OET listening. Do not attempt it, but do listen to it. Warm up yourself. Because if you go empty headed and all of a sudden you do the listening, one or two questions will go by. And these one or two questions can make you reach to 350 from 330, from 320 to 350. Two questions are very important. Always warm up, because first 2 3 questions are very important. Don't miss them out. Don't take anything for granted. Again, these instructions are more important as compared to learning these things. Obviously elimination you will learn, so but warming up before your exam is the most important thing. Most of you, 90% of you miss it. You all know it. We take exam too easy, we take stress, but we do not work hard for the exam. That is what is the problem. Work hard for your exam. Listen to something before you go. Read something. Do not attempt question, but read at least one paragraph before you take your exam. Listening and reading should be done before exam, in the same morning when you get up or after your shower. It's very important to do something. Don't go in the hurry taking your passport and all that. Gather everything before the exam day. Please be at ease, listen to something, read something. These instructions are the most important that I can give you to pass in OET reading and listening. Now let us check out the third question.
Then these injuries.
Well, looking after the muscles themselves obviously helps here. You can do various exercises that actually strengthen the hamstrings.
Now they are talking about how to prevent it. So Toby mentioned sports need to maintain ease of movement in another part of the body, warm up exercises, be cautious about working directly on the muscles. So my important words again, if you want to learn elimination method, directly word is very important. Warm up exercises words and ease of movement. Let's see. Another
So
part of the body.
make them less prone to injury.
Mm.
And of course, warming up before exercise is crucial in avoiding all sorts of muscle strains, and sports people know that. But that isn't the whole story. One interesting finding is that a lot of people who develop hamstring injuries have coexisting back problems, and there would seem to be a correlation. By loosening up the lower back, you also help the nerves that control the hamstring. Flexibility there allows the muscles to function as they should, and there are exercises people can do to help that.
Mm. And is the risk of hamstring?
It's simple. It is connected with the back. If you make the flexibility there, it will help you in the hamstrings. So maintain ease of movement, that means flexibility, in the another part of the body means at the back. B, he was saying warming up is important, but he did not say that warming up can increase the risk. So he said warming up is important, but he did not say ensure that warm up exercises are not increasing the risk. Warm up exercises will never increase the risk, not in your OET, not in sports. Warm up exercises are always important, whether in OET or this. That is what is the warm up of listening and reading that I was talking about. Warm up before you do. So warm up is very important. Then be cautious about working directly on the muscles. It was not talking about it. Rather, it was saying that you need to back is connected with the hamstring, so you need to take care of it. So according to me, first answer is B, C, and A. I will listen to it again just to make sure.
The finding is that a lot of people who develop hamstring injuries have coexisting back problems, and there would seem to be a correlation. By loosening up the lower back, you also help the nerves that control the hamstring. Flexibility there
Loosening means maintaining ease of loosening word has been correlated over here. So now the main line he will speak now.
allows the muscles to function as they should, and there are exercises people can do to help that.
And is the risk of hamstring injury something that should be taken into account?
So anyhow, I have told you strict words like directly, must, immediately, fastly, speedily, 90% will go in elimination. We all have talked about it. Please listen to all my reading lectures. Please listen to my vocabulary lectures of reading in which I have talked about how to eliminate options. These options like word directly, I always tell you, should be taken care of. Like certain word, like pain in the hamstring should be now. Toby suggests that during the intensive training. Now intensive training means strong training like sprinting. You in these kind of training, chances of chances are more. Chances of hamstring injuries are more. I don't know how did it become unmuted. Anyhow, this is the problem, guys. I'm really sorry. I thought that I have muted you, but this is the problem. When these important things are going on, you are not there. Otherwise, I always say, taking Dr. BKM's coaching, you will pass 100%. But like this, it's not cool. Sorry about this. I didn't want to record that in the lecture. That's why I do not encourage recordings when I do reading and listening. Lot of my YouTube channel followers always say, why don't you record reading and listening? Just because of this. Please, it's very important. Nothing is important than this. Nothing is important than OET for you at least. Anyhow, coming back to the topic. Intensive training programs are like intensive. So these things, intensive trainings can lead to more injuries. Let's see what is it talking about.
In training programs?
Well, yes. Intensive training of the sort you do for team sports like football can put quite a heavy workload on the gluteal muscle.
Now, by the time he's speaking, I have read three options. First, he's saying that during the injury, if you have pain in the hamstring, can be a warning sign. Third point is like people with the history of hamstring should avoid certain exercises, or working on the gluteal muscles can help avoid hamstring problems. So gluteal is a word that I can listen to easily. So if he will say gluteal muscle working will help in avoid, then it is an easy option. But A and C are like if there is pain or there is already pain. History means already having hamstring pain. Let's see.
Which can lead to a tightening around the hips, creating knots known as trigger points. These, in turn, can cause referred pain in the hamstring, reducing flexibility and increasing the risk of straining or tearing it. I mean, basic stretching exercises can help here, but also we know that muscles are more likely to strain if they're fatigued. Often, during a period of intensive training, you get cumulative fatigue.
Now, please understand, always notice your keyword. Now, my keyword was during. So by the time, this is why listening is always smart, because by the time you are reading the option, answer will not be there. By the time you will have, they always give you time to read the option. Now I have read the options. Now my main word will come during intensive care. This is my main line. So when he will say the word during, that is where my ears become double active. Let's see.
I mean, basic stretching exercises can help here, but also we know that muscles are more likely to strain if they're fatigued. Often, during a period of intensive training, you get cumulative fatigue. This can creep up on an athlete, on their muscular system over a number of weeks as the training intensifies.
And if an athlete does pull a hamstring,
Now, this question was the most difficult until now because I did not find anything except the fatigue in the muscles. He did not talk about gluteal muscle at all, so this cannot be my answer. He did not talk about the history of hamstring strains, so this should not be my answer. Now, I do not know what to do, but at least I'm sure about two options. That B, gluteal muscles was not spoken, and C, I think history of hamstrings were not spoken. But again, we will listen to it again because we were talking about things.
Quite a heavy workload on the gluteal muscles,
Oh,
which
yeah.
can lead to a tightening around the hips.
No, there is
Hamstring injuries have coexisting back problems, and there would seem to be a correlation. By loosening up the lower back, you also help the nerves that control the hamstring. Flexibility there allows the muscles to function as they should, and there are exercises people can do to help that.
And is the risk of hamstring injury something that should be taken into account in training programs?
Well, yes. Intensive training of the sort you do for team sports like football can put quite a heavy workload on the gluteal muscles, which can
work on the gluteal muscles. So it is saying can help avoid hamstring problems. Let's see whether it avoids hamstring problems or increasing hamstring problems.
of the sort you do for team sports like football can put quite a heavy workload on the gluteal muscles, which can lead to a tightening around the hips, creating knots known as trigger points. These, in turn, can cause referred pain in the hamstring, reduce.
So working on the gluteal muscles means putting a load on the gluteal muscles can cause hamstring, can't avoid hamstring. Can cause hamstring because the heavy workload on the gluteal muscle will put the pressure on the these are called trigger points, and these trigger points can further put the pressure on the hamstrings. That means working on the gluteal muscle can lead to, now listen to it again,
Programs.
Well, yes. Intensive training of the sort you do for team sports like football can put quite a heavy workload on the gluteal muscles, which can lead to a tightening around the hips, creating knots known as trigger points. These, in turn, can cause referred pain in the hamstring, reducing flexibility and increasing the risk of straining or tearing it. I mean, basic stretching exercises can help here, but also we know that muscles are more likely to strain if they're fatigued. Often, during a period of intensive training, you get cumulative fatigue. This can creep up on an athlete, on their muscular system over a number of weeks as the training intensifies.
And if an athlete...
So see, he did not talk about history at all. He did not talk about that whether the people having history should do certain exercise. C is definitely not my answer. B, now I know after listening to 2-3 times that gluteal muscles can lead to this thing. So A is my short answer now. That is what I'm saying. You will get better. And please understand, it is a practice way. Out of the 4 questions, there are 2 questions I have listened 2 times or 3 times to do them, and 32nd and 33rd were easy for me. 31st and 34th I had to do it 2 times, but in the final exam 31 or 34, at least one can be correct with my practice. This is the additional marks I want to get. Additional mark. If I would have warmed up, 31 would have been easy. 34th was still difficult because he was talking about gluteal muscle, tightening of the hip, then referring known as triggering points, and that can lead to more strains in the hamstring. So it was a difficult one to catch. 34th was the hardest question until now. So if we can fetch just 1 marks by our practice from 31 and 34, then 32 and 33 were already easy. So we get 3 marks out of 4 until now. 3 marks at least out of 4. And one can be wrong as well. So I'm taking that margin. So at least 3 out of 4, I think it should be correct. We will see the answers in the end, but I think at least 3 should be correct. Let's see to question number 35.
For the hamstring.
Now, what is the most important word in question number 35? The word is first. What is Toby's first concern when treating? First concern, main concern, primary, first, main. Let's see what is the main concern.
Can the sports injury specialist help?
Well, they'll feel the pain, maybe even feel a pop, and they won't.
Now, by the time he's speaking, I have read three options that to get that elite symptoms, reduce swelling, or to pain. Whenever a person will have hamstring injury, I have seen on the cricket grounds, they either, first of all, they want to get out of the pain. But I have learned, whenever there is extreme pain, you want to get out of the pain. And second is using the ice bath to reduce the swelling or ice to reduce the swelling. So it should be either the swelling part or the pain part. Let's see what is the first concern while treatment.
If an athlete does pull a hamstring, how can the sports injury specialist help?
Well, they'll feel the pain, maybe even feel a pop, and they won't be able to continue because the muscle will go into cramp and spasm. There are 3 degrees of severity, and the treatment will vary according to that. Fortunately, as a sports injury specialist, you're often present when the injury occurs, or you can see it on video, so you don't have to rely on a verbal account of symptoms to assess the.
So you don't have to rely, because you can see it. Being a sports doctor or being a sports physiotherapist, you are already there, so you can see it. You don't have to rely upon. You don't rely means depend. You don't have to depend upon the verbal symptoms. Means athlete does not have to describe the symptoms. A is eliminated.
Severity. Initially, you want to stop any swelling as soon as possible. That's your priority.
That's your priority, to stop the swelling. So to take action to reduce any swelling becomes my answer as far as I think until now.
You're going to apply compression bandages and possibly ice. Although there's some debate about that these days, it does ease the discomfort. And you'll certainly elevate the leg and make sure the patient rests up.
And how long will the athlete?
So did not talk about the pain again. One option would be eliminated. He did not talk about the pain at all. Two things were confusing, A or B. But he said you don't have to rely upon the verbal account. Let me make you listen to it again.
You're going to apply compression bandages and possibly ice. Although there's some debate about that these days, it does present when the injury occurs, or you can see it on video, so you don't have to rely on a verbal account of symptoms to assess the severity. Initially,
verbal account means verbal speaking. So a player does not have to describe the symptoms. So again, 33rd, 34th, now 35th, or 32nd, 33rd, and 35th are easy question. 31 and 34, I doubt. Let's see 36th.
Stop any swelling as soon as possible. That's your priority. You're going to apply compression bandages and possibly ice. Although there's some debate about that these days, it does ease the discomfort.
Now, by the time they will start talking about recovering, I have read the next 3 options. Effect may be permanent, hard to predict how long, and treatment can be counterproductive means harmful. So let's see out of these. Just the last question of the day. Please focus.
You'll certainly elevate the leg and make sure the patient rests up.
And how long will the athlete be out of action?
Well, as I say, that's going to depend on the severity of the injury. They'll have to rest up for 72 hours, whatever happens, to avoid.
72 hours rest at least. Means 72 hours means 24 plus 24 plus 3. Matlab 3 days. 3 days rest for sure.
Causing further damage. And things like heat.
Generally saying, guys, we always talk about in OET reading, what can be the answer? May wala option or can. They both can be the answer. Let's see. Most of the time when we talk about these words to be noticed, so may and can are important to be noticed. Let's see what becomes the answer, A or C. Let's see.
Say that's going to depend on the severity of the injury. They'll have to rest up for 72 hours, whatever happens, to avoid causing further damage. And things like heat and massage can be just as damaging as movement itself.
Oh,
So heat and massage can be damaging. Treatment can be counterproductive, but he did not say in less severe cases. So I have heard the C option, but I have not heard in the less severe cases. Still, my option is incomplete. If I don't find anything, then I will do C. But my option is not complete. Listen to it again.
2 hours, whatever happens, to avoid causing further damage. And things like heat and massage can be just as damaging as movement itself.
Oh.
Can be just as damaging means can be. Heat and massage means treatment can be counterproductive. So C option is half right. Let's see if he says less severe cases. That's the only word I am missing.
2 hours, whatever happens, to avoid causing further damage. And things like heat and massage can be just as damaging as movement itself.
Oh.
A grade 3 injury can take months to heal and can be career threatening for top athletes. What's more, lack of use can lead to the development of scar tissue and muscle shrinkage. In other words, the muscles won't return to their former state, even if the tear or strain itself heals. So
the muscles will not come to its original state. So maybe he's talking about the effects may be permanent in some cases. If you do not make the movement, it can lead to spasm, and spasms can be permanent. So it can be answer, and also it contains may. So when it comes to me, I am really inclined toward this word may anyhow. So if I do not find anything, I will do A. But C also seems an answer, but he did not say in less severe cases. That was these 4 words were missing. So that is what is elimination method, guys. If the answer is C, then I can't help it. But what I want to teach you, elimination method means you have to do the complete option. So C is half right, but you did not listen to in less severe cases. So you can't do this answer. Even if you want to learn, maybe this is the answer given in this listening. I'm not sure, but I will never do this as an answer because it is incomplete. So that is what I say elimination. And in A case, he's talking that in some people, they will not make any movement and that can lead to spasm and it can be career threatening, can be permanent. So means he's talking about possibility. Possibility means maybe. So in some cases means in few cases. Some cases mean in less cases. So that is speaking about. Let's listen to it again.
2 hours, whatever happens, to avoid causing further damage. And things like heat and massage can be just as damaging as movement itself.
Oh.
A grade 3 injury can take months to heal and can be career threatening for top athletes. What's more, lack of use can lead to the development of scar tissue and muscle shrinkage. In other words, the muscles won't return to their former state, even if the tear
Won't return to their former state.
strain itself heals. So part of my job is to ensure that doesn't happen by getting the muscles working again in the right way as soon as possible.
So the answer becomes A. Now I need your help to let me know. So according to me, B, C, A, C, I guess we did, or A I did because he did not talk about history. Yeah. A, B, C, A, and 35th. A was not the answer. Reduce any spelling. That was short answer. 35th was the easiest. 35th was the easiest question. 32nd was the second easiest question. And 36th was kind of confusing because half statement he spoke about C, but I did final answer as A only, I guess. Yeah. So, and also May word was there. If I want to take the risk, if I do not understand the risk, we had this conversation, we will take the risk with the May word. Let's see what you tell me as an answer, and then we can take it ahead. And also I have recorded this complete lecture, and that's pretty much it for the day. But before that, I would like to get your feedback on this thing. So can you please let me know? B?
All are correct, sir.
Last one also?
Sir, all are correct.
Very nice. That's superb. So I have told you each and everything, and also some questions, 31st and 34th questions were little difficult. You try to get 1 marks out of those difficult. Why do we do practice? To get that 1 marks out of 31 and 34. And 32, 33, 35, and 36 again was confusing. So you want at least one question to 3 questions would be easy. I promise you. 3 questions would be easy, even in your final exam. Out of the 6, 3 will be easy. You just have to score 1 out of those 3 difficult ones. If you can just use the elimination in the right way in one of the 3 questions, difficult questions, we will get our marks. 4 plus 4 plus 4 plus 20. We will make 32. And passing marks can go to even 30. So if you can secure 32, you are 100% safe. This is Dr. Bhupesh from Dr. BKM Institutes. Please subscribe our channel if you have not, and please watch these videos till end and do not get distracted. It's all about this, your attention, your dedication. How strongly do you invest in your OET, which is the most important thing for you of your life at present and for the coming generation as well. Thank you very much. Take care. And that's pretty much it from my side. Thank you.